Hey guys, if you haven't heard about Anchor by Spotify, it's simply the easiest way to make a podcast. Anchor by Spotify has everything you need all in one place. So let me explain. Now, Anchor has tools that allow you to record and edit your podcast right from your own cell phone or your own computer. Now, I've been using and loving Anchor by Spotify for 2 years now. And don't forget that Anchor will go ahead and distribute your podcast on so many listening platforms like Spotify and Apple Podcasts, and so many, many more. Now, I think it's simply everything you need to make your own podcast, all in one place. And don't forget, Anchor is totally free. So why don't you go ahead and download the Anchor app or go to anchor.fm to get started. I can't wait to hear all of your podcasts. Hey everyone, welcome back to all my listeners. Now, if it's your first time finding me, thanks so much and welcome. This is episode number 5 of my 7th season. Today is Wednesday, October 5th, 2022. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, I know it's a heavy time for so many of us. Late last week, Hurricane Ian battered homes, boats, and businesses, destroyed coastlines, and so many lives were lost in Cuba, Florida, and North Carolina as I record this episode. My prayers go out to everyone. I know it's going to be a long road to recovery and rebuilding, but I know we're always much stronger when we can band together and help out however we can, big or small. Now, all right, you guys, so what's going on for today's podcast? Well, right, healthcare, despite a major crisis in America, a major fiasco like the hurricane, healthcare never seems to rest, does it? So I've got a lot to get into today. I'm going to be diving into my compliance tips and recommendations today on some new changes to patient coinsurance responsibilities for colon cancer screenings. And I'm going to be featuring my new grab bag filled with newsworthy updates, including the facts that this is the beginning of Breast Cancer Awareness Month, and the effective date for the new 2023 ICD-10-CM diagnosis codes just became effective on October 1st. And finally, CMS's resources for providers when the PHE ends. And I'm going to be going ahead and rounding out today's episode with the remarkable quote on purpose and impact by Beyoncé Knowles Carter. If you checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help your providers paint the medical picture. If you like what you're hearing, please go ahead and hit that subscribe button now so you don't miss another episode. Please write in a review and kindly drop me a 5-star rating on Apple Podcasts or wherever you listen to my podcast. I'd really love your support. And as always, a friendly disclaimer. Remember, I'm bringing you the news, current healthcare industry news, my compliance tips and recommendations based on my over 12 years of experience in front office, in back end, in coding, and in billing for multi-specialty physicians, in compliance, and in auditing for both E&M and surgical operative reports. These are my opinions alone and are not to be construed as legal advice. So, let's get into Newsworthy. So, I developed my grab bag feature of Newsworthy because some weeks are just packed with so much news. So first, I wanted to remind you that the 1,176 new ICD-10-CM diagnosis codes took effect on October 1st, 2022, just a couple of days ago. Now, if you're still waiting for your massive codebook to arrive, that's okay. All of the new codes can be found on the CDC and CMS websites for files containing the 2023 code tables, tabular, and index, as well as the fiscal year 2023 ICD-10-CM coding guidelines. Remember, all claims starting on October 1st, 2022, must have the fiscal year 2023 ICD-10 CM codes on outgoing claims. Now, my second Newsworthy Grab Bag feature. October is Breast Cancer Awareness Month. Each week in October, I'll be sharing more information here to further awareness as well. I've decided to focus on the National Breast Cancer Foundation this month. In years past, I've devoted my attention to other cancer hospitals and other organizations that are rich in resources as well. Now, the National Breast Cancer Foundation has dedicated this October 2022 for all of us to rise or rally in sharing everywhere. Rise. Rise is their theme for the month, where they focus each week of the month on rally in screening everyone, rally in serving everyone, rally in supporting everyone, and finally, rally in sharing everywhere. Now, it may be hard for some people to talk about breast cancer, but the National Breast Cancer Foundation has 6 really thoughtful communication ideas for how you can support someone dealing with a breast cancer diagnosis. So, the first thoughtful tip is, I don't know what to say, but I'm here for you. The second tip is, do you feel comfortable sharing what you're going through? Either way, I'm here for you. The third tip, this has to be hard for you and your family, but you have my support too. The fourth, I'm not sure how to help you yet, but I'm not going anywhere. The fifth communication tip is, I'll follow your lead on when you want to talk about your journey. And finally, the sixth communication tip, I want to help. Give me some tasks I can do for you. Food, shopping, laundry, picking up the kids from school, whatever would be helpful. And finally, my third grab bag feature item is about CMS's resources for providers and when the PHE ends. Now remember, in preparing the healthcare system for operation after the public health emergency, Secretary of Health and Human Services, that's our HHS, Xavier Becerra, he extended the existing COVID-19 public health emergency, the PHE, through October 15th, 2022, and has committed to providing states, healthcare providers, and other stakeholders a 60-day notice before ending the PHE. Now, despite the fact that a 60-day notice has not occurred yet to date, meaning we will be continuing on in a PHE status after October 15th, 2022, these resources remain useful for our providers. The COVID-19 pandemic revealed opportunities to improve major aspects of the healthcare system, such as accommodating advances in technology, connectivity, operations, emergency preparedness, and the need to address underlying disparities in health and healthcare outcomes, access, and quality across the healthcare landscape. This particular CMS cross-cutting initiative aims to evaluate CMS-issued PHE blanket waivers and flexibilities to prepare the healthcare system for operation after the COVID-19 PHE. This assessment is being done in 3 concurrent phases. Phase 1 is when CMS is assessing the need for continuing certain blanket waivers based on the current phase of the PHE. For example, do providers currently need the same blanket waivers they needed early on in the PHE? Since the beginning of the PHE, CMS has added both and terminated flexibilities and waivers as needed. In doing so, CMS considered the impacts on communities, including the underserved communities, and the potential barriers and opportunities that the flexibilities may address. Now, in the second phase, CMS is assessing which flexibilities would be most useful in a future PHE, such as natural and man-made disasters and other emergencies, to ensure a rapid response to future emergencies, both locally and nationally, or to address the unique needs of communities who may experience barriers to accessing healthcare. They will use the lessons learned and assessments of the flexibilities they used to inform what steps they take in responding to future emergencies. They will aim to have this work inform the development of a playbook of flexibilities that CMS can turn on quickly if needed in response to an emergency. And finally, in the third phase, CMS is continuing to collaborate with federal partners and the healthcare industry to ensure that the healthcare system is holistically prepared for addressing future emergencies. In April 2022, CMS launched the revised CMS National Quality Strategy with a goal of ensuring that all persons receive equitable, high quality, and value based care. By implementing provisions in this strategy, they will be ensuring resilience in the healthcare system to prepare for and adapt to future challenges and emergencies. CMS is also focused on advancing health equity as they plan for the eventual end of the PHE. The CMS Framework for Health Equity, released in 2022, sets forth priority areas including standardized data collection and analysis, strengthening our healthcare workforce, particularly those serving underserved communities, increasing provision of culturally and linguistically appropriate services, and identifying and eliminating barriers to underserved communities which face accessing healthcare coverage. These priorities are consistent with a number of CMS and HHS initiatives and also in alignment with Executive Order number 13985, advancing racial equity and support for underserved communities through the federal government. Executive Order number 13985 calls on agencies to advance equity through identifying and addressing barriers to equal opportunity that underserved communities may face due to government policies and programs. Now, finally, CMS has also provided a 47-page PDF of COVID-19 emergency declaration blanket waivers for healthcare providers. Now, this particular PDF is a comprehensive resource to utilize at your practice, your facility, for when each blanket waiver remains active or when each blanket waiver terminates. And now it's time for my best practice tips in Trusty Tip. So, in today's compliance tip, I wanted to focus on changes to beneficiary coinsurance for additional procedures furnished during the same clinical encounter as certain colorectal cancer screening tests. This item was delivered in an MLN Matters article number 12656. Of significance is that it will soon be implemented on January 1st, 2023. This MLN Matters article is for physicians, hospitals, and other providers billing Medicare Administrative Contractors, our MACs, for colorectal screening tests they render for their Medicare patients. So you should be reminding your billing staff they need to know about these things, that there's going to be a reduced coinsurance for certain screening flexible sigmoidoscopies as well as certain screening colonoscopies. Now, Section 122 of the Consolidated Appropriations Act of 2021 is titled Waiving Medicare Coinsurance for Certain Colorectal Cancer Screening Tests, and it amends Section 1833A of the Act to offer a special coinsurance rule for screening flexible sigmoidoscopies and screening colonoscopies. This special coinsurance applies regardless of the code you bill for the establishment of a diagnosis as a result of the test, or for the removal of tissue or other matter or other procedure. It's effective when provided in connection with, as a result of, and in the same clinical encounter as the colorectal cancer screening test. The reduced coinsurance is being phased in beginning January 1st, 2022. Currently, the addition of any procedure beyond a planned colorectal cancer screening test for which there's no coinsurance that's applicable results in the patient having to pay coinsurance. CMS will gradually reduce this coinsurance until it's completely free for dates of service on or after January 1st, 2030. 2030. Effective January 1st of 2022, when a screening colorectal cancer procedure with G0104, G0105, or G0121 has the modifier P as in Paul, T as in Tom appended to it and submitted on the claim line with a HCPCS code 10000 through 69999 or G0500 or 00811 or CPT code 99153 for diagnostic colonoscopy or diagnostic flexible sigmoidoscopy or other procedure to indicate that a screening colorectal cancer procedure with HCPCS code G0104, G0105, or G0121 has become a diagnostic or therapeutic service. Coinsurance is then reduced or waived for claims as follows. And the MLN is indicating that for dates of service in calendar years 2023 through 2026, the reduced coinsurance is 15% reduction. So that will be starting up January 1st, 2023. For dates of service in calendar years 2027 through 2029, the reduced coinsurance is 10%. And finally, for dates of service on or after calendar year 2030, Medicare waives the coinsurance completely. So it's important to keep track of big updates like this to continue driving patient satisfaction at your practice, at your facility. And finally, I focus Season 7 Spark on purpose and impact. I want this 7th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires the need for purpose and impact in all we strive to do. So, in this week's inspiring quote in Spark is from Beyoncé Knowles Carter. Power is not given to you. You have to take it. So very true, right? I think this is an amazing quote that reminds us that we have to take ownership of our own power. We have to embrace that power to serve our purpose. We have to remember to never shy away from that power, never give away that power. I think this quote reminds us that when we make peace with our own power, that is when we can make our greatest achievements, serving our purpose. I am happy Beyoncé's spark still burns brightly in all of us today. So that wraps up today's episode. And as always, I appreciate you all diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Please have an amazing week ahead, and remember to carve out time for yourselves to prevent burnout. I know we're all heavily consumed with stress and anxiety in our everyday lives. And of course, please continue staying safe and healthy as well, because we are still in a public health emergency status. Now, in my final note for today, like I said, it is Breast Cancer Awareness Month. We have had a major hurricane crisis in the United States. So try your very best to help your community and help yourself where you can, which means go ahead and get your breast cancer screenings when you have openings at your doctor's office, which means try to make donations, however big or small you can, to whatever breast cancer organization you are a part of. And if you are able to send a donation or provide some help or assistance to those affected by the hurricanes in either Cuba, Florida, the Carolinas, please go ahead and do so. I know everybody would appreciate it. All of our strength and prayers go a long, long way. So anyway, you guys, thank you so much for listening in on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.